reported today in The Verge. Fearful reactions to the new coronavirus can put lives at risk. People in the US are worried about the new coronavirus outbreak. That concern is warranted. The virus is a scary new threat, it can cause serious harm, and there aren't any medications that can stop it. That's not to mention the cancellations of schools, popular events, and the general disruption to people's lives it's causing. But fear, and the things people do when they're afraid, changes and drives the societal impact of the virus. Viruses can't function on their own, they require a host, a person, in order to survive and reproduce. That person makes choices and behaves in certain ways. When that person's behaviors are driven by fear, it can lead to discrimination and decision-making out of line with public health recommendations, which can make the outbreak even worse. That's the major common thread connecting outbreaks from the Black Death to the current novel coronavirus outbreak. Fear and panic can magnify the harm done by a virus. People can get worked up and do bad things in response, says Philip Alcabes, professor of public health at Hunter College and author of Dread: How Fear and Fantasy Have Fueled Epidemics from the Black Death to Avian Flu. In the US, panic over rising case counts has triggered a rush on grocery stores and pharmacies. In New York City, for example, there's hardly a bottle of hand sanitizer to be found, and pasta and beans are in short supply. It's good to prepare for disruption to everyday life, but there's a difference between preparedness and panic buying, and the latter can cause shortages. More troublingly, people in the US and around the world have also been buying up supplies of surgical masks and respirators, despite pleas from experts not to. Masks may offer some people comfort, but they don't provide much protection against illness if they're not used properly, and lay people usually don't use them properly. When they're squirreled away in people's homes, they're not available for healthcare workers who actually need them and know how to use them. The World Health Organization says that there are worldwide shortages of masks and other protective equipment, and that puts healthcare workers at risk. That's a problem for everyone, and it can exacerbate outbreaks. If healthcare workers, who are in close contact with COVID-19 patients, get sick in high numbers because they don't have proper protection, it adds to the caseload for hospitals. It also leaves fewer nurses and doctors to treat patients. Panic also unearths racism and discrimination. The novel coronavirus originated in China, and when it started to spread, anti-Asian racism took off around the world. The same thing happened during the SARS outbreak in 2002. It's an old story, Alcabes says. When the Black Death first came to Europe, there were rumors. For more on this story, visit the news article link.